Hello, I'm Anna Marie de la Vega. This is Focus. Thank you for listening. Today, we're talking with David Wood, a professional counselor and the regional director of Family Care Center. First of all, welcome, David.
Thank you very much.
So, Family Care Center is now the largest outpatient mental health provider in Tennessee.
That's correct.
Who can come to Family Care Center?
We provide mental health services for all age groups, ages 5 through 99. We provide outpatient therapy, medication management, and transcranial magnetic stimulation.
Whoa.
For all patient demographics, populations, any presenting issues or symptoms.
So what was the last one? Transcranial magnetic?
TMS, transcranial magnetic stimulation. It's a short, very brief, very intensive treatment for major depressive disorder.
Oh, wow.
Yeah, for patients who tend to not be very receptive to antidepressants.
Yep.
And they've maybe tried several different medications and they've engaged in therapy before. Mm-hmm. TMS may be a very, very helpful solution in treating their depression.
I'm guessing there have been quite a few developments in the past 20 years for people who have mental health issues.
Absolutely. Absolutely. So TMS, for instance, was actually FDA approved in 2008. But it has not been very readily available. It's a little cost prohibitive initially for providers and clinicians to get into it. Mm-hmm. It requires a lot of training and a big upfront cost investment.
Yep.
But that's something that FCC has found to be very, very helpful in treating treatment-resistant depression for our patients. And so we've absolutely made that investment. TMS is available at all of our clinics, and we see spectacular outcomes, somewhere around the 90% positive clinical outcomes for patients who engage in therapy and TMS.
And by therapy, is outpatient therapy?
Outpatient therapy, meeting with an individual therapist on a weekly or possibly biweekly frequency.
Do they do it in person? Do they do it on Zoom or...
Both, whatever's most convenient. We do know that outcomes are better when it's in person, when you're here in the room with someone, when you're meeting with a therapist face to face. You get to just build that deeper connection with a provider. But there are also people, they live in rural areas, they may be non-ambulatory, transportation may be difficult.
Yep.
Or they're just busy. They got a sick kiddo at home, they're running family around in between jobs. And telehealth is also always available. Okay,
that's really good to know. Part of the reason we're talking now is because I got a notice a while back that said May is Mental Health Month. And I just thought, when I get to finally talk to you, I'm going to ask you, why do you think Mental Health Awareness Month is May? Because I would have thought probably more depression in the wintertime, or if you live in Seattle, or maybe things like that. Why May?
I don't know that there's a real clear reason why. Maybe it was just available. It's a longer month, so that helps.
July was hot dog month.
Yeah. But it is also a stressful season. Schools, elementary through high school, through college and universities tend to be wrapping up in May.
Oh.
Families are preparing for summer vacations, summer breaks. There's a lot of jobs or seasonal jobs that change through the summer season. Mm-hmm. So it is a high stress season, and I think it may be intentional to try to hone in on the needs of the community and individuals, their mental health needs, to just really shed a light on that in a really busy and kind of stressful season.
Wow.
But your point is accurate and well taken that we do see increases in depression and through seasonal affective disorder through the winter months when there's less sunshine. People tend to be outside less when it is uncomfortable outside and cold. There is definitely an increase in depression symptomologies.
I noticed you said when there's less sunshine, and because now I've spoken with someone a while back, and he said it has been found that getting yourself a light, what is it called, a little natural light that gives yourself, you give yourself light treatments basically.
Yeah.
Keep it on for a certain amount of time per day that can actually help you. Yeah,
it absolutely can help. In my opinion, there's no replacement for being outside,
right,
in the sunshine.
Yeah.
Being outside in nature, going on a walk, taking in the sounds and the sights around you. Even if you're living in a suburban area and you're downtown, taking in the sounds and the smells and people watching and being in the sunshine, it's just a different experience than maybe sitting in a room and having an artificial light.
Right.
Shed light on you, ultraviolet light, and your body still can take that in and convert that into dopamine. which is really, really helpful.
Oh, okay.
It helps. It's one of the primary agents that helps regulate our emotions. But there's really no replacement for being outside in the sunlight in nature.
So try to, if you can.
Absolutely.
Very good, good info. I think there's still a stigma. I know there's still a stigma about people saying, I see a therapist, I have treatment for mental health issues. I think there's a huge, like a shame and embarrassment. And personally, I've found that as long as I've lived, I've had a good full life. I've just found out, like this past year, about CPSD, complex PTSD, but being complex because it was childhood trauma. Childhood trauma. I had that. I knew that people say something. We had a rough, growing up, blah, blah, blah. And I thought, well, I've survived that. I'm fine. And then I realized that there's this thing that I didn't even know about, childhood trauma, that informs and has my brain reacting in a certain way to this day. And it affects me. And I didn't even know it existed. Are there things that people maybe just need to talk to somebody and go, my life is not flourishing. I'm just not, I don't think this is all there is. And they need to just talk to somebody. Absolutely.
Absolutely. So I would make two somewhat counterintuitive points on that. First, I would say a good mental health clinician, which is most of them that I've ever met and have interacted with, they are going to help you find, as you're reflecting on those childhood events, and we actually have an acronym for that. We call them ACEs. It's Adverse Childhood Events.
Yes.
Yeah. And a good clinician will help you determine, am I making something out of nothing?
Yeah.
Was it really okay? There has been such a stigma around pursuing mental health. That pendulum is swinging the other way, which is a really good thing. Mm-hmm. But there's also a reality that we do not want to make mountains out of molehills, right? My dad didn't buy me the right colored bicycle when I was in 8th grade, and I have trauma because of it. That's not a real problem.
Right.
However, and much more frequently, we do see adults in certain generations, because of what they went through and they survived, they tend to focus on the good aspects of their childhood. And here they are, they're successful, they have a family, they have a career, they're okay. So therefore, what happened to me in childhood must have been acceptable or good enough that it's made me who I am today.
Yeah.
And as adults, we don't like to think that we don't have autonomy and control over who we are.
Oh, that's right.
But when we're children, we're being programmed. The way people treat us, the way the structures in the household or lack thereof that we grew up in are definitely forming us.
Yeah.
And we learn how to navigate and interact in the world as a child. Mm-hmm. So if we grow up in a home that was lacking structure or maybe affection or validation was consequential to how we performed.
Oh, yeah, if you're good.
If we're good, maybe we become that people pleaser, or maybe we become very performative or perfectionist.
Oh, wow.
Because we're so concerned we may let others down, or if we make an error or fail, that's how people in the world will perceive us. Mm-hmm. Those are initiated, those types of thoughts or worldviews begin to develop in childhood.
My mom had mental health issues. And kind of like children of alcoholic parents, she had prescription drug issues. And I remember she would be kind of asleep on the couch all day, stay awake all night, and make me often stay up with her. And I thought, well, I've kind of grown past all of that. But now I see that I was the parent.
Yeah.
I had to take, when my baby brother was born, when I was 8, he had cerebral palsy. So I had to be the little parent. I learned how to cook. I learned how to take care of him, and I was the parent. And my dad was like gone at work. He would just let her do, like, it was everything that she wanted, mama wanted. He'd go, your mama really wants to blah, 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 blah. He would enable her and seem like the good one. And so I just kind of grew up knowing that if I can keep everybody happy, if I can like take care of everything, I can cook everything, I can clean everything, and I don't want my house to look like theirs did when I was growing up because it was messy and hoardery and all of that. So I just have struggled my whole life with just trying to make sure everything's kind of perfect.
Yeah.
Not perfectionism, but just I do all the cooking. I'll take care of everything. I'll take care of everything. And my husband, now that I found my dream husband, he's okay to let that be. But I found I was getting resentful.
Yes.
And then when I discovered the childhood trauma thing, realized when I wanted to tell him, you just want to sit there on your butt and let me do everything, I realized by listening to some of those therapy sessions, it's like, I wanted to say that to my mom. You just sit on your butt, let me take care of everything. Mm-hmm. So like I'm so old in life years now to just finally in the past year start to realize this.
Yeah. Yeah.
I think people need to not be afraid, but also if you're doing some things that are maybe not working and you find yourself with resentments and things like that, I think that might be because I thought I'm perfectly normal and I've kind of succeeded in a big way.
Yeah.
But it was not satisfying and fulfilling to me.
Absolutely. Absolutely. And it's also important to remember that just because we are identifying and reframing some things from our childhood or in those relationships with our parents or who they were as parents, mm-hmm. just because we're identifying some bads does not mean that we are labeling them as failures as parents or that we don't have to throw the baby out with the bath. We're not reframing our entire childhood. We still have those beautiful memories of riding bike through the neighborhood and childhood fantastic memories or aspects of our parents that were great that we as parents also want to emulate. But that doesn't mean that it isn't valuable and worthwhile to identify, well, what didn't they do so well?
Yeah.
What struggles were they going through? Mm-hmm. Because in your shared example, and thanks for sharing that, two big things there. One, you experienced a role reversal where you stepped into this pseudo-parental role and mm-hmm. having to care for your high needs younger sibling. Mm-hmm. But also your father modeled what in your childhood mind you perceived to be the appropriate way to manage somebody dealing with an addiction, which was passivity and enabling, which is the reverse way that is helpful to manage and help and relate to a person who's struggling with an addiction.
Right.
Passivity is enabling.
Yeah.
Strict, rigid boundaries is loving to a person who's struggling with an addiction.
Wow.
And your father modeled that kind of enabling behavior probably through trial and error. And maybe there had been confrontations at some point, but maybe he found what he tried hadn't worked. Yeah. And so he was just trying to love your mom through it mm-hmm. and keep the peace for her, himself, and for his children.
Yeah.
And so it's very understandable why he may have come to that conclusion.
Oh, yeah.
And there's no judgment there.
I'm glad you said that because it's not like I'm going, my mom was bad, my dad was bad, my blah, blah, blah. But I know there were some things that affected me because of how I had to react to them. Absolutely.
Absolutely. And this is, where a very common clinical vernacular would come in. We would call those unhealthy ways of coping, we would call them maladaptive.
Oh.
And we could identify those as, well, I learned that in childhood through this very unhealthy and a situation that was not okay. Yeah. And we're not pacifying that. We're not being permissive about that, but we're also not painting with broad strokes saying, well, they failed as a parent.
Right.
It was, no, they didn't know what to do in that situation.
Exactly.
And they did what they could. And they still tried in love and authentically tried to care for us and take care of the family.
To the best of their ability.
But in that particular area, they just didn't know how to do it.
Yeah.
So if I'm needing to learn how to navigate as an adult, how to navigate that kind of relationship or environment that I'm now in as an adult, I'm going to need to look elsewhere. I'm going to need to look just outside of that, my current toolbox, and incorporate some new tools. And that could be through interactions and communication with a therapist. It could even just be a family friend who you know was very successful in that particular element of, let's say, parenting mm-hmm. or a certain season of life that you see them navigating very gracefully and very well.
Right.
A hard season of life, but they're crushing it. Well, we can pursue them and say, well, what are you doing in this? How are you making this happen? You're making this look so easy, and you're doing it so gracefully. What kind of advice or insight would you have for me? Because this is an area of life that I feel like I'm struggling in. So it doesn't even always have to be professional, but it is wise to seek counsel. It is good to look outside of ourselves and to others around us, to build connections, to invite people into our struggles. Something an old pastor friend of mine always used to say is, you cannot hide and heal at the same time.
Whoa.
Yeah, and that has always stuck with me. Like, not only just as a therapist, but just I feel like I've been in seasons of my own life where I've made that a mantra.
Yeah, you cannot hide and heal at the same time.
Yeah.
And there are things that we do feel like sometimes as adults we have to hide, because maybe it's a weakness, maybe it's a resentment, maybe it's that I'm not perfect, maybe I'm coping in other ways.
Yeah.
You want to hide it.
Absolutely. Well, and as you identified earlier, being quite a people pleaser, you probably have resentment, and then you feel guilty about having resentment.
Yes.
So then the last thing on earth I would want to say is to my partner, I'm feeling resentment towards you.
Right.
Oh, because now we're being honest, but in our honesty and our vulnerability, we feel like we're letting them down.
Oh yeah. I've said to myself, I know this is so selfish, but I don't feel like doing that today or whatever. I know this is so selfish. I know this is so bad.
Yeah.
Because that's what I was taught when I was a kid.
Yeah. and it's been reinforced. And I said this before we started, people pleasing and being very high in agreeableness, it's a very attractive trait in a person.
Yeah.
People around you will really appreciate that trait, that personality component of you.
Yeah.
Some people will take advantage of it, maybe even unknowingly.
Sure.
But they will. And we can then find ourselves feeling resentful for it.
And hurting relationships.
And it could even be unconscious. Like, no, I don't really find myself enjoying time with that person. And maybe we haven't even put our finger on it. Why? Well, maybe it's because they're taking advantage of you, and it's not their fault they're taking advantage of you. It's actually your fault.
Right. Oh, I know. One of the things I learned is like if you're people pleasing, like sometimes you enjoy doing things and giving things and being there for people and helping. And I'm a caregiver.
Yes.
Now, caregiver.
I love that you said caregiver, because I wanted to bring it to this a little bit too. Women's mental health particularly has some different nuances than when we're talking about men's mental health. There's different issues that arise. Of course, across men and women, there are shared presenting symptomologies and diagnoses and things. But at Family Care Center, for instance, about 62% of our patients who present with depression are women. 61% of our patients who present with anxiety are women.
Wow.
And it has to be a different approach in therapy between men and women. And oftentimes it is caregivers. Oftentimes there is that maternal quality in their identity.
Oh, whoa.
They're very selfless. They are serving. They're caring for their children. They're caring for their spouses. Who's caring for them? And if they are not on the receiving end of some kind of reciprocal effort, they're pouring themselves out and maybe not being filled up. And the problem with that is not that they're pouring themselves out, because I think we could all agree serving those around you, loving your children, loving your spouse, providing a stable and safe and loving and validating household is about one of the most fulfilling and honorable things we can do as a parent, as a mother and a father, but that has to be sustainable.
Right.
And if we are not making sure that our needs are being met, and sometimes that means setting some boundaries to take care of ourselves, we can't expect that we can perform to that kind of degree or magnitude indefinitely.
Yes.
Yeah.
I tried that once, and I hit a wall.
Yeah.
No, I hit a wall, and I couldn't, and I had to take some time off.
Sure.
Because there's like, you work all day, you work at the house all night, you work vice versa, whatever.
Yeah.
You said something about, if you're just joining us, this is Focus. I'm Anna Marie, and we're talking with David Wood, a professional counselor and the regional director of Family Care Center. It's the largest outpatient mental health provider here in Tennessee, and we're talking about mental health issues, therapists, finding therapists, what to do. And also, you mentioned women their mental health issues tending to be often from a caregiver, a support angle.
Sure.
I mean, they do that and they overdo. One of the things you mentioned was that they sometimes keep giving so much that they need someone to take care of them sometime. They need to be where they can have their needs met.
Absolutely.
But if you pour yourself out so much, you can make it appear that you don't have needs. You can make it appear that you're Wonder Woman or a super person and that you don't have needs. You just can keep going, and people will treat you that way because they don't know, because you haven't expressed that you have needs as well.
That's exactly right.
I need somebody to pet my head and say, hey, just, here, let me be nice to you and bring you dinner.
Sure. And especially for moms of children, young children or adolescents. Children and adolescents are going through their own development and their own phases. Rarely do they possess the interpersonal aptitude or the thoughtful consideration to be able to look at their mom and say, Mom, you're a good mom. I really appreciate everything that you do for me. Mm-hmm. Sometimes our kids have some kind of miraculous moment where that strikes them and they feel that kind of urgency and they would say something like that. But often being a parent and being a mother it's a pretty thankless job. Mm-hmm. Until our kids grow and get older anyways.
And then they become that, and then they're like, oh, man.
And then they have their own children, and then they realize, I never said thank you to my mom or dad nearly as much as I should have.
Yeah.
I certainly went through that myself. But part of that maternal identity is caregiving. Mm-hmm. And there's a lot of meaning. There's a lot of power in that identity where those moms, those women in that maternal sense do tend to pour themselves out. Mm-hmm. And you cannot draw water from an empty well.
Yes.
And your point is excellent that they will be perceived as not having their own needs. Mm-hmm. If you do not allow the people around you to see that you have needs mm-hmm. and to be vulnerable about that. Like I said before, you cannot hide and heal at the same time.
Yeah.
And sometimes you may have people in your life who are just waiting for an opportunity to meet your needs and to speak encouragement or validation or appreciation into your life. Mm-hmm. And you haven't given them an open door to do so.
Whoa. And
all you need to do is be honest about it.
Because if it really is more blessed to give than to receive, you're not giving them an opportunity.
Exactly right. Exactly
to be their
right.
best person.
Exactly right. Like myself, for instance, as a therapist, there's a personality assessment called the Enneagram. And it's 9 different personality types. And I'm a number 2, which is identified as a helper. Mm-hmm. I genuinely feel and find myself, and I have through the course of my whole life, the dynamic that I experience in my friendships and other interpersonal relationships, I see myself as a helper. Mm-hmm. I want to do things tangibly for my friends or my family. I, in fact, feel a little bit lost in relationships if I'm friends with someone and they don't need something from me.
Right.
And I look for opportunities to do tangible things or to even just speak encouragement or be there if they're going through something. Mm-hmm. But if everything's pretty good and their life's kind of on track and they're happy and things are great, sometimes I can feel a little bit lost in the relationship.
Whoa.
Or I can even begin to feel insecure, like, they're friends with me, they love me, they appreciate me, but what am I offering them? What am I bringing to the table? we can begin to feel insecure in a relationship as helpers mm-hmm. if we don't feel like we're bringing much. Mm-hmm. Now, that can obviously go way too far and be very unhealthy and fall into that people-pleasing territory. Mm-hmm. But I bring that up to remind folks that there are people in your lives who are helpers. And they desire to meet your needs. They, in fact, feel loved when you give them an opportunity to meet your own needs.
Whoa.
They will feel loved by it. I feel honored when people come into my office, patients or even friends and family members, share things that they're struggling with. And they're honest, they're vulnerable. I feel honored that they trust me with that mm-hmm. and that they invite me into their situations with them, into their life. Mm-hmm. I feel respected. I feel validated and encouraged by that they trust me with that. and I'm there for them. I want to support them and encourage them through it.
Wow.
And it doesn't burden me. There's a lot of folks out there, we think that, well, I don't want to share that because I don't want to burden my problems on other people.
Yeah.
Well, if I love you and I'm a helper, I don't feel burdened by it. I feel honored, and it gives me purpose.
Whoa.
Like, don't take away that opportunity for me to shoulder a burden with you when that's why I'm here and why I believe I exist.
Whoa. I have to think about that a lot, and I think that's going to resonate with a whole lot of people. So anybody can come, any age, whoever needs mental health help.
Absolutely.
Do they have to be referred?
They do not have to be referred. We see essentially all major commercial insurances. We see veterans through the VA. We work with TRICARE and active duty military servicemen and women and their family members. They do not have to be referred. They can reach out to Family Care Center. We have a website they can go to if they search for Family Care Center and outpatient mental health care. And yeah, all ages from essentially verbal, so typically around age 4 to 5 and up through all age groups. I myself work with adults and couples and geriatrics. In every one of our clinics, we have child and adolescent specialized therapists and med management prescribers, psychiatrists. And all the way through to marriage and family therapists and licensed clinical social workers, clinical psychologists, and psychiatrists.
I don't know what all the differences are, but I would love to have you back.
Sure. If
you would come back. And I think we're done with my therapy session for now. I did not mean to share that much.
No, I appreciate I love it. It's my calling. I like I said, I feel honored that I can meet people and they invite me into things that they're going through. And surprisingly, that's almost every therapist I know. And a lot of people who aren't even therapists, they're that type of person. They want to be there for you.
Yeah.
And we just have to give them an opportunity to.
Well, that's what we're going to do.
Cool.
And if you want to find more information about Family Care Center, you can look it up online, the largest outpatient mental health provider in Tennessee. And our guest today is David Wood, a professional counselor, as you can tell, and the regional director of Family Care Center. Any final thoughts that you want to add that is important that we maybe missed out on?
Yeah, I would say with May being Mental Health Awareness Month, one, it shouldn't be consolidated to just a month. This is absolutely something that we want to be aware of and mindful of year round. If you need help, if you are struggling with feelings of despair or thoughts of escape or running away or maybe even harming yourself, please reach out. Call 988, the suicide hotlines. There are wonderful supports out there, and there are people who not only are willing to help, they desire to help.
Yeah.
They want to be there for you. You cannot hide and heal at the same time.
Amen. Thank you so much.
You're very welcome.
We're going to put some links on our Focus Facebook page as well. Thank you for listening today. Make sure you join us again next week. I'm Anna Marie, and that's Focus.